During pregnancy, which of the following is not increased? A. Cardiac output. B. Neutrophil count. C. Fibrinogen. D. Blood urea. And the correct answer is D. Blood urea. There is an increased glomerular filtration rate which peaks at about 13th week of pregnancy and can reach levels up to 150% of normal. Therefore, both urea and creatinine levels are decreased in pregnancy. In which stage Oedipus complex occur in children? A. Oral stage. B. Anal stage. C. Phallic stage. D. Genital stage. And the correct answer is C. Phallic stage. According to psychoanalytic theory, Oedipus complex is a desire for sexual involvement with the parent of the opposite sex and a concomitant sense of rivalry with the parent of the same sex, a crucial stage in the normal developmental process. A bleeding disorder characterized by deficiency of factor 8 and 9 is termed as A. Thrombocytopenia, B. Leukemia, C. Both A and B, D. Hemophilia. And the correct answer is D. Hemophilia. The denominator in vertex presentation is A. Occiput, B. Mentum, C. Sacrum, D. Scapula. And the correct answer is A. Occiput. The denominator is a bony landmark on the presenting part used to denote the position. In vertex it is the occiput. In face it is the mentum, that is chin. In breech it is the sacrum. In shoulder it is the scapula. The amount of blood ejected during each ventricular contraction is termed as A. Stroke volume, B. Cardiac output, C. Tidal volume, D. Heart rate. And the correct answer is A. Stroke volume. Which hormone is responsible for the development of the ovum during the menstrual cycle? A. Luteinizing hormone, B. Follicle stimulating hormone, C. Beta human chorionic gonadotrophin, D. Progesterone. And the correct answer is B. Follicle stimulating hormone. A follicle stimulating hormone secreted into the bloodstream by the pituitary causes ovum growth. Parkland formula is used in which patient? A. Paralyzed patient, B. CKD patient, C. Burns patient, D. CVA patient. And the correct answer is C. Burns patient. The Parkland formula is also known as Baxter formula, is a Burns formula developed by Dr. Charles R. Baxter. It is used to estimate the amount of replacement fluid required for the first 24 hours in a Burns patient so as to ensure the patient is hemodynamically stable. The term used to denote when a woman is having more than one husband at one time. A. Monogamy, B. Polygamy, C. Polyandry, D. Group marriage. And the correct answer is C. Polyandry. Polyandry is a practice in which women have two or more husbands at the same time. The most common type of ectopic pregnancy is A. Tubal pregnancy, B. Ovarian pregnancy, C. Abdominal pregnancy, D. Cervical pregnancy. And the correct answer is A. Tubal pregnancy. A tubal pregnancy occurs when the egg has implanted in the fallopian tube. This is the most common type of ectopic pregnancy and the majority of ectopic pregnancies are tubal pregnancies. Which is the most common site for fertilization in the fallopian tube? A. Intramural, B. Isthmus, C. Ampulla, D. Infundibulum. And the correct answer is C. Ampulla. The second segment of the fallopian tube is the ampulla, which becomes more dilated in diameter and is the most common site for fertilization. Name the non-stimulant drug with norepinephrine reuptake inhibiting action used in the treatment of ADHD. A. Atomoxetine. B. Clonazepam. C. Pimozide. D. Methotrexate. And the correct answer is A. Atomoxetine. Atomoxetine is one of the newer additions to the armamentarium of non-stimulants used in the treatment of ADHD, attention deficit hyperactivity disorder. It is a specific norepinephrine reuptake inhibitor. This drug has been extensively studied and has been approved by the FDA for the treatment of ADHD. Which anti-tuberculosis drug causes poor vision and difficulty in color perception? A. Streptomycin. B. Rifampicin. C. Pyrazinamide. D. Ethambutol. And the correct answer is D. Ethambutol. Ethambutol is the most commonly implicated drug. It is generally well tolerated but known to cause optic neuritis, more specifically retrobulbar neuritis causing blurred vision, decreased visual acuity, central scotomas, and loss of red-green color vision. The exact mechanism of toxicity is not understood. Which among the following drug is used to treat the symptoms of irritable bowel syndrome and may cause side effects like dry mouth and difficulty swallowing? A. Omeprazole. B. Dicyclomine. C. Magnesium sulfate. D. Nexium. And the correct answer is B. Dicyclomine. Rose Bengal test is used in the diagnosis of A. Brucellosis. B. Whooping cough. C. Bronchiectasis. D. Rheumatoid arthritis. And the correct answer is A. Brucellosis. Brucellosis is a bacterial infection that spreads from animals to people. Most commonly, people are infected by eating raw or unpasteurized dairy products. Sometimes the bacteria that cause brucellosis can spread through the air or through direct contact with infected animals. According to Sigmund Freud, which component of personality operates according to the reality principle? A. ID. B. Superego. C. Ego. D. Trust. And the correct answer is C. Ego. Ego is the component of personality that operates according to the reality principle. According to Sigmund Freud, the reality principle is the ability of the mind to assess the reality of the external world and to act upon it accordingly, as opposed to acting on the pleasure principle. The tactile epithelial cells are also known as A. Delta cells. B. Beta cells. C. Sperm cells. D. Merkel cells. And the correct answer is Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.